Yeah. So in this video series, we are starting case discussions that will be useful for exam going PGs also, as well as for the newly joined residents. They will get an idea what all history or examination to be done in the different cases they get in admitted in the ward. So today we are discussing the thyroid case. This is basically a benign thyroid. So I'll present the case and Dr. Shivani will give her inputs as well as can share the important things that can be asked, or if anything I have missed, she will point out, and what all other theoretical as well as the clinical questions that can be asked in the case presentation in the given case will be discussed by her. So we'll try to keep this case presentation as short, as sweet, as crisp as possible. So stay tuned. So good evening, everyone. This is Dr. Krishan. I am presenting the case of a patient. My patient name is Ram Kanya, who is 41-year-old female. She is housewife by occupation and is a resident of New Delhi. She presented with a chief complaint of swelling in front of the neck since 4 years. And these all are information are shared by herself, and the information shared is reliable. So
Krishan, can you please share your screen?
yeah, you are not able to see the screen. I have already shared.
No, 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 I'm not able to see.
Uh, but 1 minute here. It is showing you are screen sharing actually. So it should be visible. It is not at all visible.
Now it is like,
Yeah. So
now,
uh,
now I can see. Okay.
yeah. So coming to the history of present illness, the patient was apparently well 4 years back when she developed a swelling in front of the neck, which was insidious in onset, gradually progressive, which progressed from size of the P to current size with due course of the time, persistent without any aggravating or relieving factors. So, Dr. Shivani, if you want to put any inputs in this slide, you can say.
Okay. Whenever your patient was apparently all right, well, since 4 years, so
Yeah.
you have to specifically ask when she noticed the swelling and
Yeah.
from what time the swelling was present, because these are actually two things. Okay.
Yeah. Yeah.
Okay.
And moreover, I feel one thing is important that will be important for the our viewers, that one that in case of thyroid swelling, there is something called whether it is felt first or seen first. Generally in case of breast
Mhm.
lump, we feel the lump first, but in the case of thyroid we see the swelling first, we
See
don't.
the,
So this is a
okay.
this is a common question as in exam, so viewer should keep in mind. So further coming to the history of present illness, there was no history of neck trauma, no history of pain over the swelling, no history of pus point or discharge over the swelling, no history of difficulty in breathing, swallowing, no history of change in voice, no history of swelling elsewhere in the neck, no history of radiation exposure in childhood, and no history of loss of appetite, significant weight loss, chronic cough, evening rise of temperature, and night sweat. Any inputs you would like
Okay.
to?
Yeah, Krishan, see, Dr. Krishan, whenever you are telling a negative history, you always have to think about the differential diagnosis.
Yeah.
Because for our viewers also, I'm telling that whenever you are taking a negative history, you should always have a differential diagnosis to rule out that history. Okay,
Rightly
so
pointed
no
out.
history of neck trauma, you should have a differentials. Okay.
So generally, in cases of trauma, we have hematoma. So we have ruled out that there hematoma. In pain over the swelling, we have ruling out abscess. So every means every thing we have ruled out by asking a negative history. Similarly, one thing I would like to point out that instead of no history of radiation exposure in childhood, it should be the uh, no history of high dose radiation exposure, because low dose radiation exposure had hardly any role in the etiology or pathophysiology of thyroid cancer or thyroid means any thyroid tumor like that. So likewise we should also think of, the examiner can ask these kind of question that key, what are the conditions in which low dose radiation are given and in which high dose radiation are given. So we should keep in mind in any kind of like that key radiotherapy. Actually low dose, there are minimal indications of low dose radiation therapy. One very common of low dose at present, there is very less, or we can say least indications of low dose and radiation exposure. One is acne, so you can keep in mind that, and the other causes are all high doses. In all other conditions we give high dose radiation. So there is no history of
So
palpitation.
we should keep in mind that whether yeah, yeah. Dr. Krishan, continue.
There was no history of palpitations, tachycardia, excessive sweating, mood changes, menstrual abnormalities, increased appetite, loose stool, tremors, intolerance to hot, and decreased sleep. There was no history of decreased appetite, constipation, depression, irregular menses, intolerance to cold, dry skin, increased intolerance to cold, common dry skin. This is increased sleep and excessive weakness. No history of periorbital swelling, swelling over the lower legs. We have ruled out myxedema here, and in first two point we have ruled out hyper and hypothyroidism. No history of loss of consciousness, seizures, headache, chronic cough. Basically,
Hyper and hypo.
yeah. And in this we have ruled out malignancies. No history of loss of consciousness, seizures, headache, chronic cough, blood in the sputum, shortness of breath, blood in vomitus, blood in the stool, abdominal pain, jaundice, frequent fracture, and bone pain. Generally in all we rule out malignancies, and even in ear cases we rule out malignancies. This is very important. No history of any other ear, nose, and throat.
Uh,
Yeah, Dr. Shivani.
Dr. Krishan, I want to ask one question. Whenever you are writing all these complaints, that is signs and symptoms of hyper and hypothyroidism, can we directly write that no signs of hyperthyroidism or hypothyroidism? Can we write it directly
Yeah, it
in
also
the
depends.
history?
Actually, it also depends on examiner to examiner. Uh, Actually, many examiner will point out that
Okay.
why you haven't asked the history of each and every. Plus, it also becomes a vague. If we write no history of any symptoms
Hypo
suggestive
and
of hyper or
hyperthyroidism.
hyper, so it also become vague that we have. Then they will ask us questions. Ki, what all history you have elicited, what all history we have taken. So that will it has both pros as
Okay.
well as cons, but I will suggest our viewers to write this as a individually. This will also basically and especially first year, if you are in year for post graduation, you should try to write each and every symptoms of the hyper and hyper. This will help you to remember these also, and plus this will give you a comprehensive idea of what all are the symptoms of hyperthyroidism as well as hypothyroidism. So instead of advocating for writing as no history suggestive of hyper or hyper, I'll write as a no history of this, like that. But otherwise also correct,
Okay.
but it also
Okay.
depends on the examiner. So coming to the next slide, which is of past history. Patient is a known case of hypothyroidism on tab thyroxine sodium 50 microgram once a day. There is no history of hypertension, TB, diabetes, asthma, seizures, jaundice, blood transfusion, any significant medical or surgical illness. So I think one question that there are many questions, but one rare question examiner can ask: ki, what are the various available chemical forms of thyroxine, like that? So they can ask about levothyroxine
Okay.
and all everything, as well as thyroxine sodium and other salt in which it is available. So I will advise the viewers to read once. Regarding the family history, there is no similar complaints in the family, no significant family history. Anything you want to point out
Here,
in family history?
whenever you are asking about the family history, in case of female, it is very important. If she is female, and it is very important to if she is a male, because chances of being male, if it is occurring, the family is three
Actually,
times more.
your voice was muffled just right
Okay,
now.
so it
In
is
last
very
one
important whenever.
in last 1 minute, your voice was muffled too.
Hello,
So can you repeat your point once again?
hello.
Yeah,
Okay,
now it is clear. Yeah, say.
yeah. Hello. Now you
Yeah, yeah,
Ha. I wanted to add this point that whenever you are taking a history of thyroid, it is very important to see whether she is having any family history or not. Because if she is a female, then there is a 3 to 4 times more chances of having a history
yeah,
similar in the family. And next to if he is male, then the chances of malignancies are more. Okay.
yeah, yeah,
Hello.
yeah. Wonderfully
Okay,
pointed out.
so the chances of malignancies are more, so it is very important. Okay,
Yeah,
okay, please say.
yeah. So coming to the personal history of the patient, patient is housewife and follows mixed diet. She has normal sleep pattern, normal bowel and bladder habits. There is no addiction. Her last menstrual period on 2nd May 2022, which was normal flow and regular cycle. Her socioeconomic, she belongs to, as per socioeconomic economic status, which we follow is modified Kupuswami scale. She belongs to the lower middle class. So one thing I would like to point out that she is 41, but she hasn't achieved her menopause. Her menstruation is still continuing.
Okay, Dr. Krishan, I want to add one point there. Whenever you are asking for a personal history, please ask very thoroughly, because if she is hypothyroid female, then she must be having some menstrual history. There might be or there might not be, but you have to thoroughly ask this first. And next also the bowel and bladder habits.
Yeah,
Okay, because if she is hyperthyroid, there must be a chance of diarrhea or a constipation if she
or
is
hypothyroid.
hypothyroid. So these are the important points. Yeah, where most of the patient miss, and we just blindly write that no history, no history, but it is very important
Yeah,
to see whether she is really having a history or not.
yeah. So I would like to advise our viewers that each and every point we ask in a history taking is an art that will help you to make a provisional diagnosis, and you can reach up to the correct diagnosis without any examination even. Just on history, you can make the diagnosis. So be thorough with the history taking. So coming to the general physical examination, patient is examined after taking proper consent in a well illuminated room in a sitting position. Patient is conscious, cooperative, well oriented to time, place, and person. Her vitals were pulse was 84 per minute, normal in character and volume, taken in right radial artery in sitting position with no radial or radiofemoral delay. Respiratory rate was 14 per minute, regular. So if you are writing that thoraco-abdominal or abdominothoracic, you should keep in mind that कि males में क्या होता है females में क्या होता है, like that.
That is
Abdomen.
particularly in males, it is abdominothoracic.
Yeah.
You can remember it like man, MAN, abdominal thoracic. Okay, A आता है उसमें. And one more thing I would like to add here, that is a sleeping pulse rate. It is very important. If you are able to take it, then you should mention like that, or if not, then you should mention that we were not able to take the sleeping pulse rate, but you have to somewhere mention it,
Yeah.
because it is important in
Yeah.
the thyroid.
So it is also important कि sleeping pulse rate कब लेते हैं. Normally text book में जो लिखा है उसके हिसाब से 4 AM लेते हैं. But there are so many controversies and all कि अगर 4 AM पे हमारा patient नहीं सोया है and all. ठीक है, आप एग्जाम में ये बोल सकते हो कि we couldn't take the sleeping pulse rate क्योंकि एग्जाम का ड्यूरेशन आपको 1 घंटे में केस प्रेजेंट करना होगा. बट जब वार्ड में पेशेंट एडमिट होता है तो आप स्लीपिंग पल्स रेट लो. अगर आप ड्यूटी पे नहीं हो तो जो आपका रिलीवर है उससे बोलो कि इस पेशेंट का स्लीपिंग पल्स रेट लेना है. थायराइड केस जब भी एडमिट हो, मेक एज अ फर्स्ट ईयर, मेक इट एट इट योर हैबिट. जब आप अपने अपने यूनिट के पेशेंट का ओवर देते हो नेक्स्ट यूनिट के जो इमरजेंसी वाले लोग होते हैं, सो उनको ये चीज जरूर बताओ कि इस पेशेंट का लेना है स्लीपिंग पल्स रेट. The BP recorded was 110 by 74 millimeter of mercury, which was in right arm sitting position at the level of the heart. Temperature, patient was afebrile to touch. There were no pallor, icterus, cyanosis, clubbing. There were no significant lymph node enlargement or edema. So one important thing is why we are seeing for lymph node enlargement. Basically, the main purpose is to rule out malignancies. So question
And
can come.
there is a unique, yeah, yeah.
Other
Yeah,
question.
continue.
Other questions examiner can ask you, what are the other things we'll look to rule out malignancy. Yeah, this is.
Yeah,
So Dr. Shivani, you can continue your discussion, what you were discussing.
yeah. There is one more importance is that whenever means whenever we come across any of the malignancy, mostly we see a 2A or 2B lymph node enlargement, or level 2, level 3 group, or level 4 enlargement. But in case of thyroid, it is very important to note that
Hello.
central
Hello.
most commonly seen. Hello, yes, hello,
Dr.
am I
Yeah,
audible?
Dr. Shivani, your voice was muffled, so can you repeat what you were saying? Ki in thyroid, which group of lymph node we commonly see?
Yeah, in the normal malignancies of nose and oral cavity and oropharynx, we normally encountered a lymph node of level 2 and level 3. But in case of thyroid, it is totally different. We'll first encounter a central, that is pre-laryngeal lymph node, mostly
Yeah.
is palpable. So, and which is very much a diagnostic of a malignancy. So we have to keep in mind that also
And
whenever we are
this is one reason ki commonly, even if lymphadenopathy is present, it is a higher chance that we may miss it in case of thyroid.
yeah,
It is
and
not
that's
an
why
easily visible region of the body.
yes. So we
So
have to keep in mind that also.
yeah. So JVP was not raised. There was no evidence of dry skin or increased swelling in hands, palmar erythema, hand tremor, tongue tremor. No eye signs were seen.
Hmm.
So
I also one more thing. Eye signs are very important in case of thyroid. There are many signs. Actually, 30 to 24 to 30 signs are there. But we have only 7 to 8 signs are there which are mentioned in the book. So it is very important to go through all the signs. And for the viewers, I would like to say that you have to be pit pat with all these signs. Okay, they are very important for the thyroid
yeah.
case.
So Dr. Shivani, can you please enumerate all the important signs which viewers should read?
Yeah, there are many signs. I will tell some of them.
Hello.
Derilimple sign. Hello.
Yeah. See.
Yeah. Geoffroy sign. Derilimple sign.
Yeah.
Mobius sign.
Yeah.
Lead lag sign.
Yeah.
Okay. Uh, and there are many actually.
Stilbeck
And
sign. You can
so
also include.
viewers should read that.
Yeah,
Okay.
exophthalmos, viewers can. Mobius sign is important. These all are the 6 7.
Yeah.
Any mnemonic, Dr. Shivani, you follow to remember these?
Actually, no, I have not made any mnemonic for that because I have seen the case. So I actually not using it, but surely I will do something with
Soon,
the
soon
science and
we
will
will
tell them.
share the video of different kind of different signs we see in the patient on our YouTube channel. Real patient video we'll share,
Yeah,
so our
yeah.
viewers can
Though so that you will remember more.
yeah.
Yeah,
So coming to the next slide. So coming to the systemic examination on cardiovascular system, S1 S2 heard normally, no murmur. Cardiovascular system is important because in the case of thyrotoxicosis we get atrial fibrillation. So this is one important thing. In central nervous system there is no gross sensory or motor deficit. In respiratory system there is bilateral air entry equal, normal vesicular breath sounds, hard, no added sounds. In per abdominal examination, soft, non-tender, no organomegaly. So I would like to point out one thing ki in per abdominal examination, why per abdominal examination is important in the case of thyroid, because in cases of malignancy, the fibroid liver uh, basically can indicate the metastasis to that region also, as well as the uh, this is one important, as well as the organomegaly can show us the can indicate that malignancy is there. Anything you would like to point out in systemic examination?
No, you proceed.
So coming to the examination of the face and
One point is there, Dr. Krishan. Whenever we are in the systemic examination, in the previous slide, I would like to point out one thing, that whenever the patient is having a primary thyrotoxicosis, more of a CNS symptoms are
yeah, this
there.
is this
CNS
is
symptoms and
wonderfully
severe
pointed out.
symptoms are both.
Yeah, in case of secondary we
Yeah,
have cardiovascular.
yeah.
Yeah, this is
So it
important.
is very important to see which signs are more. Yeah. Whenever you are means giving a presentation over this case, it is very important to look into these points also.
So coming to the examination of face and neck on inspection, a globular swelling, uh, 8 cross 7 cross 4 centimeter present over the anterior aspect of neck over thyroid region, extending horizontally from anterior border of the right sternocleidomastoid to approximately 1 centimeter posterior to anterior border of left SCM, vertically from superior border of the thyroid cartilage to
Yes.
point 0.2 centimeter above the supraesternal notch. So, Dr. Shivani, anything you would like
Yes.
to highlight here?
Here it is very important. Yeah, it is. You have wonderfully explained the extent of the thyroid swelling, because it is very important whenever you are any of the swelling. If you are explaining, it is very important to explain the extent of the swelling, and it is rightly explained in your presentation. Please proceed.
So, one thing I would like to tell the viewers that uh, uh, what is thyroid region? Examiner asked. So, what is thyroid region? Thyroid region is the region between supraesternal notch, hyoid to literally both side SCM, sternocleidomastoid. This is called thyroid region. So, you should know what is thyroid region. So, coming to the uh, uh, further part of the examination, means inspection part of the examination, swelling moves with deglutition and lower margin of swelling can be visualized. Swelling doesn't move on tongue protrusion, which is characteristic of thyroglossal cyst, subhyoid bursitis, as well as uh, prelaryngeal lymph node. Neck movements normal, skin over the swelling normal, no pus point or discharge, no scar, sinus or fistula. One thing I would like to point out that कि जब आप एग्जामिन करते हो प्रोट्रूजन स्वेलिंग का मूवमेंट विद टंग प्रोट्रूजन, तो आपको पेशेंट को बोलना है कि स्लाइट एक्सटेंड करे नेक को. क्यों? क्योंकि बेसिकली हम इसको कब करते हैं, थायरोग्लॉसल सिस्ट को रूल आउट करने के लिए, और थायरोग्लॉसल सिस्ट का जो ट्रैक्ट होता है वो क्वाइल्ड होता है, सो बेटर मूवमेंट अप्रिशिएट होता है. So this is one important thing you should remember. So coming to the clinical photographs, this is the clinical photograph of the swelling. This is another clinical photograph. We have so many photographs, but we have used here two. So swelling is palpated from behind the patient in sitting and neck flex position. So Dr. Shivani, can you point out the can you mention the name of this method which we have used?
It is I think I'm not able to recollect the name. Very
So
impulse.
let's discuss the different types of
One
method.
graph is okay.
Let's discuss the different kind of method. So regarding palpation, for small swelling we use the thumb, that is called Kryl's method. For bigger swelling we push the swelling to the opposite side with other hand and palpate with the other hand. This is called Lahaye's method. So what is Pizello's method? Pizello's method is patient put the
Patient will hands up
on the occiput
by the side of the ear. Yeah.
so on palpation.
Hello.
Yeah, on palpation Inspectory findings confirmed there was no rise in temperature, non-tender, the swelling is non-tender, smooth surface with defined margins, soft to firm in consistency with no pulsations. Swelling is mobile in horizontal plane, non-fluctuant, non-reducible. Lower margin of the swelling can be palpated. Skin overlying swelling is pinchable. Trachea is central in position and laryngeal crepitus present. So this is also shows that there is non-invasion of the surrounding structure. There is little chance of malignancy. Bilateral carotid pulsation palpated at normal side. No palpable cervical lymph metastasis. This also rule out malignancies. So on percussion over manubrium sterni, a resonant note is obtained. This is done to rule out retroesternal extension. On auscultation, no bruit is audible over the neck swelling. Oral cavity, oropharynx were normal. So, Dr. Simani, can you please point out the importance of examining oral cavity in the cases of thyroid swelling? Hello?
Sir, whenever you are doing a hello,
Yeah,
hello,
yeah, say. You are well audible.
I think the sound is not audible.
Yeah, you are well audible.
Hello.
Hello?
Yeah, whenever you are, yeah, I would like to means combinedly say this, that whenever you are always look for a oral cavity whenever you are dealing with any of the neck masses. Okay, whenever you are seeing any of the lymph node, whenever any of the swelling, the first and the fourth important is that you have to very well see the oral cavity, look for any infection, because most of the infections, malignant conditions, are oral cavity present as a swelling. So
Yeah. Uh, Coming to the indirect laryngoscopy, it was within the normal limit. Basically, pre-op we say for we look for uh, vocal cord mobility and chink. Basically, ear and nose examination were in normal limit. Coming to the summary of the case, our patient was 41-year-old female housewife by occupation, resident of New Delhi, presented with a painless, gradually progressive, non-fluctuant globular neck swelling approximately 8 cross 7 cross 4 centimeter since 4 years. Swelling moves with deglutition with no feature of hyper or hypothyroidism and no evidence of retroesternal extension, pressure symptoms, or malignancy. So, most on the basis of history and clinical examination by provisional diagnosis is cold goiter. So, this is all about the our case presentation. Now we will discuss something. Dr. Shivani, you want to discuss something related to the thyroid case, or what are the theoretical things that can be asked from the viewers in their post graduation exam? You can enumerate or discuss those things.
okay, firstly, whenever you are seeing a case of a thyroid, first consider it as a swelling only. Don't consider it as a initially as a thyroid, and please treat it as a swelling. Go for a proper history, proper examination. See for the eye signs, which I have already Dr. Kishan has mentioned in his presentation. And and just like a swelling, you have to first see for ultrasonography. Whenever you are suspecting a thyroid, do a thyroid function test. It is very important. And importance of FNAC, thyroid score, and ultrasonography is very, very, very important in case of a thyroid. And for the first year PGs, whenever you are encountering a case of a thyroid, please go and see the signs. Go and see whatever you are ruling out in the history. Please go and see for that. You will never ever miss the important findings. Means it is very important to note these findings. Okay. And the next is in the according to the exam, it is very important to know the differential diagnosis of a thyroid swelling first. Then which are the swelling in the neck which moves with the deglutition. What are the midline swellings? And in if a because it hasn't seen that the malignancy is very common in a male patient, and the thyroid swelling is very common in female patient.
Yeah, one thing I would like to tell,
Okay,
say that
you realize the importance.
there is if there is upper midline small swelling, so most common differential is thyroglossus cyst. And one take home message for the first year post graduation, I would like to tell that in any swelling in the thyroid region, what is thyroid region I have already discussed. You must, after clinical examination, you must order these tests: USG Doppler, not USG, USG Doppler, Second, FNAC. FNAC or USD guided FNAC depend on your center. Most commonly, FNAC gives the result. Third, thyroid function test. Fourth, serum thyroglobulin. Fifth, if it is young patient, then anti-TPO. In older, anti-TPO become useless, but in young, anti-TPO. So these 5 investigations must to be ordered in any swelling in the thyroid region if the patient comes in your OPD. Dr. Shivani, you want to highlight any more thing? You can. Hello.
Explained it very well. Every point is covered in the exam. Indirect laryngoscopy, I would like to stress over that. Indirect laryngoscopy, many of the people will miss that point. So don't ever miss indirect laryngoscopy examination. It is very important medico-legally also before the surgery.
Yeah. And all the triangles, Lowe's triangle, Beho's triangle, these all you must remember. These are actually asked in the exam, but these are surgically important, as well as the surgeries for the thyroid, recent staging and guideline. For example, if the patient is more than 55 year, it upstages the disease. So these are the important things. There are so many things to discuss in the thyroid. थायराइड का जब केस आता है तो उसकी वाइवा बहुत लंबी जा सकती है, बहुत कुछ पूछा जा सकता है, तो डर लगने लगता है जब आपको शॉर्ट केस थायराइड मिलता है, तो आप डर जाते हो क्योंकि इसका वाइवा कहीं भी जा सकता है और एनाटॉमी इतनी ज्यादा डाइवर्स और इतनी ज्यादा है कि इट कैन पुट यू इन ट्रबल अगर आप अच्छे से नहीं पढ़ो. सो ऑल द बेस्ट to you people for the exam. Hope you like the video. Thank you.